Hi, my subject is a 38-year-old male who had met with a motor vehicle accident 7 weeks ago. He had a left elbow fracture and dislocation and underwent open reduction internal fixation and was on a cast for the last 7 weeks. He came to physical therapy after two days of removal of cast. Hi, my name is Benson Verkey and I'm your physical therapist for today. From what you told me, you have 3 out of 10 pain in your left shoulder, 7 to 8 out of 10 pain in your left elbow, and more stiffness than pain in your wrist and your shoulder. Is that correct?
Yes.
Thank you. The procedure that I'm going to do is called as mobilization. It has 4 grades. Grade 1 and grade 2 focus on reducing pain. Grade 3 and grade 4 emphasize on improving your range of motion. During this procedure, if there is undue pain or discomfort, please let me know so I can modify the treatment.
Okay.
Thank you. The first technique that I'm going to do for the shoulder is called as a posterior glide. Since you have a limitation in your flexion beyond 90 degrees, this anterior glide will help in improving this range and this limitation. So what I'm going to do is I've already stabilized the proximal part of your shoulder joint with this towel here, and I'm going to stand right over here. I could either do this and do at the beginning of the range, or since you have a limitation at 90 degrees, I'm going to place my hand on the distal part of your shoulder joint. Now, I'm going to start with grade 1. I'm going to do 10 oscillations of grade 1, which is a very minute movement which you barely can feel. Then I'm going to do grade 2, which is a large amplitude movement, which is still at the beginning of the range. I'm going to do 10 of that. Then I'm going to do large amplitude grade 3 movement, which reaches almost to the end of the range. And then grade 4 is a small amplitude movement performed at the end of the range. Are you okay?
Yes.
Good. Thank you. The next technique I'm going to do is also a posterior glide, but this is to help improve his internal rotation. My patient has a 60 degrees of limitation of internal rotation. So again, I have stabilized the proximal part with a towel, and what I'm going to do is hold the elbow or the forearm at the limit of restrictions, and then have my hand placed on the distal part of the shoulder. And I'm going to start with grade 1, which is a small amplitude movement at the beginning of the range. After 10 oscillation, I'm going to move to grade 2, which is a large amplitude movement, which is still at the beginning of the range, and this is to help you with the pain. Now I'm going to move to a large amplitude grade 3 movement, more closer towards the restriction, and then a small amplitude grade 4 movement at the end of the restriction. Now I'm going to focus on the posterior glide, since there is a restriction on the external rotation. The external rotation is restricted at 30 degrees. So I'm going to again stabilize the patient is in prone. And I'm going to stabilize the proximal part of the shoulder with the towel. And I'm going to place the elbow on my thigh to keep the arm in a neutral position. I'll place my hand just distal to the shoulder joint. And again, I'll perform grade 1 oscillation, which we can barely feel. That's a small amplitude. Now there is a grade 2, which is a large amplitude at the beginning of the range, which also helps to reduce the pain. And then grade 3, which is again a large amplitude movement, reaching the end of the limitation. And then the grade 4 is a small amplitude at the end of the range. Thank you. Now we're going to focus on abduction restriction, which is at 90 degrees of limitation. So what we're going to do is an inferior glide, which is also called as a caudal glide. Here again, I have the patient relaxed with the proximal part stabilized with the towel. And what I will do is I will take the patient's shoulder range to the end of the limitation, or near the end of limitation, which is 90 degrees. And then I'll have my hand placed just at the distal joint, and then I will place grade 1, which is a small amplitude movement, grade 2, which is a larger amplitude movement at the beginning of the range, 10 oscillations of that, Grade 3, which is again a large amplitude movement reaching the end of the range or near the end of the range. And then grade 4, which is a small amplitude movement at the end of the range. How do you feel? All right. Now we're going to move to the elbow joint. Since the patient said that he had 7 to 8 out of 10 pain in the left elbow, I would want to start with grade 1 and grade 2, and if there is no pain, then I can progress to grade 3 and grade 4. So the next movement that we're going to do is to help improve your flexion of the elbow. You have a restriction of up to 15 degrees from the 90-degree position of the elbow. So what I'm going to do is I'm going to place, since your shoulder is stabilized, I'm going to place my hands at the distal part of the elbow joint and place gentle distraction if possible. Does that bother you?
No.
Okay, and I'm going to do grade 1, which is a small amplitude movement at the beginning of the range. And I'm going to do grade 2. Does that bother you?
No.
Okay, that's a large amplitude movement, again, at the beginning of the range. Now grade 3, which is again a large amplitude movement, but that would reach almost to the limit. Does that bother you?
No.
Okay. And then the grade 4 is a small amplitude at the end of the range. Does that look okay?
Yeah.
Okay. Thank you. When you're ready, show me. Hi. Now we're going to focus on the elbow joint extension. Since he has a limitation of 15 degrees from the 90-degree range, the patient is placed in a prone position with the proximal part of his arm stabilized on a towel, and my hand placement is going to be just proximal to the olecranon process, and most of the movement should come from my body and through my shoulder than from my hand. So I'm going to also stabilize the distal part of his forearm and perform grade 1, which is a small amplitude movement. If it is painful, do let me know.
Okay.
Okay. Are you relaxed?
Yes.
Okay. If you want, you can keep your head onto the other side. That way, that way you're more relaxed there. So that's grade 2, which is a large amplitude movement, not reaching the end of the range. We're going to progress to grade 3, which is to help improve your range. Again, it's a large amplitude movement reaching the limit. And now we're going to progress to grade 4, which is a small amplitude movement at the end of the range. Does it feel okay?
Yes.
Okay.